Hello, my name is Berkay. I'm a third year medical student at the University of Sheffield. I'm currently undertaking my student selected module at the Delta Health Center, supervised by Mr. Sami Abdul. Today, we're going to be going over what surgical retractors are, a small history of them, their designs, how they protect tissue, and their practical selections. So, why does retraction matter? To begin with, we want to be able to have a line of sight when it comes to the wound and the place that we're going to be working with. It the retraction is not to pull something apart; it's to create a stable space for dissection, like ligation and suturing. Uh, Also, we want to make sure that the tissue is safe as well. We don't want to uh, damage the tissue in terms of having too much pressure on the retraction side of things. As if we put too much pressure, we can reduce perfusion, we can bruise the tissue, and we can actually make the tissue worse as well. Also, we're thinking about the team ergonomics as well. So imagine that you're holding something for about an hour, 2 hour. You're gonna need something stable. You're gonna need something that is comfortable, and thus the ergonomic side of retraction is quite important as well. So a brief history about the surgical retractors. Uh, Honestly, this is just to get a grasp of what retraction actually was and to how it is right now. So to begin with, they started with simple hooks in the Roman times, and they started designing more and better exposure devices. Uh, and some of them they have self-retaining wound spreadings with the weight liner uh, retraction systems being sort of invented around 1905. And then they actually started using the self-retaining abdominal retractors to make sure that it stays where it is. And they started having some sort of rib surgeries around 1914s with the World Wars coming along. And they have improved in the late 80s with laparoscopical surgery starting to take place more with better and smaller retraction systems. And finally, we have more compliant and better fixed systems in the modern era that we can utilize. So what makes a retractor safe? As we can see in the infographic over here, we want to make sure that our traction vector has a large contact area, thus spreading the pressure and not bruising or reducing the perfusion of the tissue. Narrow hooks usually concentrate the tissue, so they should be only used for shorter periods of time. The traction vector, it usually means that wherever you're pulling is wherever the retraction should go. So pulling up and out is usually how you would pull out the retractor. Also, when it comes to duration and assessment of the retractors, to make sure that they are safe, the smaller the you should be able to hold the retractor in the wound for a prolonged amount of time. That would ensure that the tissue is still going to be safe and you're not going to have any issues with it. Also, when you're working with nerves and vessels, you should be able to hold the retractors in a very specific amount of space with very specific amount of force. So the sensitivity of the retraction also makes it safe as well. So there are four categories of surgical retraction. There are the handheld ones, which they are usually used for um, different simpler surgeries. Self-retaining ratchets, they usually are better as they provide a hands-free exposure and they have an adjustable tension. Fixed frame retractor systems are a bit more bulkier, but they offer a multi-directional retraction for deeper and complex exposures. And lastly, we have the newest retractors, which are the compliant and circumcisional retractors. These are used for minimizing the tissue trauma, and they maintain even distribution of retraction, as they have many points of retraction for the wound itself. So the handheld retractors, why are they useful? So they are usually used on superficial or skin sort of tissues that we can see. They can be used for deeper and abdominal sort of wounds. In the cases of Richardson retractor over here, and superficial skin ones are seen just like these one over here. The delicate structures, such as veins and tendon hooks, they have smaller retraction hooks, as you can see over here, with a better grasp of handle, so they can maintain the retraction much better. Continuing with the self-retaining ones. So in terms of self-retaining ones, we have the weight liner, as we talked about in the history, where it sort of just has the grasp over here with the um, it's like a can opener pretty much. You just open it up and then like it can hold its grasp there much better. So in terms of a better and deeper retraction systems, we have the Balfour over here, and for thoracic surgeries, we have the Finickito retractions, where it's a bit more fixed and it's used to spread the rib quite well. And lastly, we have the fixed frame systems, as we talked about in the circumcision ones. We have the Book Walter and Omnitrack ones. Continuing, so how to choose a retraction by its surgical context. In general, abdominal cases, we usually use Richardson, as it's the handheld one that can go deeper with the push out, pull out system. They can use Balfour as the self-retaining ones. For the skin, a hand or a breast, they usually use SAN or skin hooks usually. They have a finer exposure with shorter face, but they are better for cosmetic wounds and edges. For vascular and tendon ones, they have the vein retractors, tendon hooks, and they are usually a bit more smaller, but they are much better at precision retractions, and they avoid stretching and compression. In terms of orthopedic ones, we have deeper retraction systems such as Hochmann's or Gelpi or a weight liner, where they can self-retract it themselves. And in the thoracic, we can see that we have the Finecchio, as we talked about priorly. And in the gynae and obs, we have Balfour or Doyen with a better stable pelvic slash abdominal access. So going forward, uh, pressure tissue and safe techniques for the retraction itself to reduce the force that you're going to use when it comes to retraction. Simply start by using smaller forces and moving your force up or retraction higher as you go along to decrease the reduce the force amount that you will use. Also, when it comes to increasing the area that you're gonna use when it comes to retraction, that means that it's gonna be higher loads of force and tension that you're gonna use in terms of retraction. And you should limit the time that you should be using the retraction to reduce any sort of trauma or reduce perfusion. And you should protect the nerves and the vessels under the blade as much as you can, and retraction usually provides that. So, in terms of laparoscopic retractions, it is quite there isn't that many options at the moment, but for cholecystectomy or any sort of liver operations, we use Nathanson's liver retractor to be able to firstly put it through the laparoscopical thoracars, and to be able to maintain the liver's edge with its curved structure. It's usually self-retaining. It's you can't adjust the retraction force. It's just to create space for you to work with, and retraction usually does that. Also, there are the handheld ones where you have the fan-shaped laparoscopical tips to be able to just hold the tissue up just with the laparoscopical tips that you can use. Continuing, also retraction is a costly matter. Reusable instruments, they have higher upfront prices, uh, and they do need decontamination after each procedure, but they are usually better in terms of your cost and uh, cost analysis. Uh, Single-use instruments, they usually are. They don't need decontaminating. They don't need any reprocessing, but they produce more waste, and they are a bit less cost effective in the higher term. And historically, they are both sort of used, uh, but with single use policies in some surgical areas, they are single use retractors are usually preferred. So, how to choose and hold a retractor in the theater? Imagine that you are in your surgical placement or in your surgical um, theater at the moment. So, you're gonna see which tissue that you want to retract and have a clear line of sight, and you're gonna decide which sort of tissue that you're gonna be holding with the retractors. Afterwards, the blade that is gonna be holding the retracting tissue. Are you gonna think about what sort of pressure that I'm gonna apply there? Do I want a precise, or do I want a broader, where I can hold more tissue back with less uh, less damage to the tissue. Or also, we're thinking about afterwards the vector, how we're going to be holding the retractors. Are we going to be holding them sort of which direction that we're going to be? So thinking about the T microdynamics there. And if we are going to use the retractors for a long time, we would want something that's going to be self-retracting. If we're going to be using something like Rorschach's in the abdomen, we would want something that's going to be quite a low amount of time with a low that force that's going to be required because it's going to be handheld one. Also, retraction also is could get in the way of the surgeon itself, and we're just trying to provide a line of sight uh, for the wound for the surgeon to be able to work them on. And if we're blocking the visibility, that just means we're not doing what the retraction pursues to be. So the take-home summary for retractions. So choose your retractor by depth, tissue type, surgical field, and need for dynamic versus fixed exposure. Uh, so imagine also broad, smooth, compliant surfaces to reduce the focal pressure. Uh, Also, self-retaining systems are hand-free, but they can hide sustained tissue load, so you wouldn't be able to see the tissues reduce perfusion, and that can lead to bruises and even tissue death. So cost decisions also should include sterilization, durability, and availability of the retraction systems. And also, the safest retraction is the one that requires the minimum effective force applied in the right direction in the shortest necessary time. A retractor is not something that holds the tissue back, it's something that shapes the operation. Thank you so much for listening to my presentation. And these are my references. Please let me know if you have any more questions. Thank you.